Negative findings in a research should not be published. Negative findings should not be published is a wrong thing. Negative findings can be added in a research. Publishing paper is important for getting promotion in academic institute. Publishing research findings help to identify the research gaps. Publishing research findings improves the credibility of a researcher also. And the next question is, a senior resident of a psychiatric department of a medical college wrote a manuscript based on a thesis work. He has put his wife's name as a co-author, who is working in the physiology department of the same college. So in this question, we can say that this wife should be contributed in designing this thesis, research thesis work. He cannot give the authorship to anyone, since it is a research work, but he cannot give authorship to anyone. And also the guide should decide. The guide cannot decide who should be the authors. And in a different department, the researcher from different department, it is a good practice to add researchers from a different department as authors. Next is the authorship. The authorship confirms credit, implies responsibility and accountability of the published work. The International Committee of Medical Journal Editors recommends some criteria on authorship. It is mandatory to declare the contribution of each author. But it is mandatory that all authors should approve the final version of the manuscript. The plagiarism, can be copying and pasting a content from a published manuscript. It can be copying of someone's idea, that is plagiarism. It is a serious. It can be considered as a serious publication misconduct also. Urkind is one of the software used to check plagiarism. The consequences of the plagiarism of manuscript is the journal can retract. The journal can retract the manuscript. Institute can take action on the author and researcher, and also the researcher loses the professional reputations also. Next question is, when you finished writing a manuscript and plan to publish it, you should submit. You should not submit to multiple journals at the same time. You should submit to a journal and wait for the journal's response first. Then only the first step is that actually. Okay. And submit to many journals. Once it gets published in one journal, withdrawal it from the other journal. It is not a good habit. Submit the same manuscript in different language to different journals is not a good habit. The researcher conducts a study to identify the risk factors for exacerbation of bronchial asthma. The researcher was due for job promotion. However, the researcher was lacking enough published to ensure promotion. Hence, in order to have maximum number of publications from the work, the researcher decided to produce 3 different manuscripts instead of one manuscript, comprehensively covering all aspects of the study. This act is called salami slicing. The Publication Ethics Committee on Publication Ethics, that is COP. Next is a group of researchers submitted a manuscript for publication based on a drug trial because they did not register the clinical registry of India. We know that every this study RCT, it should be registered under the clinical registry of India. One reputed journal rejected the paper. The researchers resubmitted the paper in a different journal, and this journal published it without asking any queries. It is necessary to register all drug trials under Clinical Trial Registry of India. The journal which published the paper is likely to be a predatory journal. Okay. Best practice for determining the authorship is authorship can be based on the criteria given by the ICMGE, and the common people should read the research findings. The clinical registry in India should be registered with the Clinical Trial Registry of India. And the next question is, a neonatologist plan to conduct a clinical trial to explore the effect of interventions exon hypothermia of newborn age less than 7 days over intervention. All of the following are true about the trial except. Ethical committee approval is must to conduct the trial. The trial should be registered under the Clinical Register of India, that is already informed consent should be taken. But age appropriate assent is not a must in this trial. Okay. The investigators can follow ICMG guideline to determine the authorship. Okay, that already we discussed. Next question, a group of researchers submitted a manuscript in a reputed journal. Even after 5 months of submission, they did not receive the peer review comments from the journal. The author decided to submit the manuscript to a different journal without informing the editor of the previous journal. Which of the following? That is simultaneous submission. Okay. So, if a doctor A is in the process of writing a review of literature for her thesis, her guide has instructed her to avoid plagiarism. Dr. A should take all the following measures to avoid plagiarism, that is, avoid copy and pasting, acknowledge original sources, take help of anti-plagiarism software. Copy from her own previous work is not a good habit. Okay, good habit. And conflict of interest, the readers can determine the influence of conflicts of interest on the conclusion of the paper. Okay. An editor of a reputed journal found that most of the findings of manuscript matches with the previously published paper by different author. The editor considered it as a case of plagiarism. Which of the following about academics to true? The journal can retract the article if already published. The editor can inform the author's institute about it. The researcher may lose their reputation also. It is mandatory to trial under Clinical Registry of India. After completing it, ethical issues, informed consent should be taken. Okay. Altering the original data to obtain a statistically significant result by the researcher is known as falsification. Including a guest author to improve the acceptance of the manuscript is not a good idea. Okay, that is wrong. Okay. And conflicts of interest can be suppressed. Main thing is publishing the research findings. Publication often helps in career progression and academic promotion. It's a way to communicate research finding with the peer group. Okay. And submitting a manuscript to more than one journal is called a simultaneous publication. Departmental head is not HOD is not an essential criteria for authorship. The criteria for authorship is conceptualizing the study, drafting the manuscript, approving of the final manuscript. Next question, a postgraduate in a medical college submitted a proposal to the ethics committee of the institute. The committee found that proposal is a mere copy of an early proposal from the same department. This act is plagiarism. Unpublished work must be acknowledged in a manuscript is a true statement. Direct or indirect influence of which of following aspect is considered conflict of interest is financial, personal, and social aspect is considered as a factor of conflict of interest. Thank you.